Okay, shooting this video a couple times. I had too many interruptions. All right, it's a video about one of the qualities you need to develop as a nurse. And again, I preface all my videos by just saying, it's my view. It's a bedside nurse's view. It's me, med surg specifically. So it's different for a camp nurse, home visit nurse, home care, different. This is bedside med surg. Assertiveness is one quality you do need to develop. And I think a lot of people mistake that to being too assertive, like an A personality, Karen type, Ken type, jagoff. You don't have to be obnoxious. You don't have to be rude. Maybe sometimes rude. But you don't have to be a jerk. You don't have to be an ass. You don't have to be an asshole. You don't have to be an asshat about this stuff. All those, whatever you want to coin the term. You don't have to be obnoxious about it. You do need to be assertive to some degree. And that is something that needs to be honed and tempered. Not an a-hole, but not a pushover. You're advocating for your patients. And this is why I take a very paternalistic, parental view to my patients. Is they're like children. I advocate for my child. I advocate for my patients that way. It was very easy for me to put that role and use that template in place. So would I, if this was my child, how would I advocate for him or her? That's the way I do it. And it served me very well. In my opinion, it's done well, because sometimes you have to go against the provider. Sometimes you have to go against other nurses. Sometimes you have to go against the patient's family. Sometimes even the patient themselves. Because it's like, no, you need to take this medication or you're going to have a seizure. Sometimes they don't know better. Sometimes they do know better. They just choose not to. Sometimes, whatever. You're there for their well-being. But you respect, if the person wants to end their life in the sense of they're in comfort care and DNR, you respect that, But if they're kind of out of it and they're suicidal kind of thing, no, sorry, you draw a line. Those are aspects you need to learn. So it's a question of assertiveness. And this came up recently, it triggered in my head. One of my friends, let's call him T, wants to be a charge nurse. He and I have spoken months about this, and they keep passing him over. Whatever reason, when we're in dire need, I don't understand it. If we're not in dire need, because whatever personality flaw they're seeing, I'm not going to second guess management in that. But I don't see it. I've known this guy for 6 years now. We started together. He actually failed out and came back in. So I actually became a nurse like a year and a half, 2 years ahead of him, because he had to go back in. So he's a success story. Not a fail story. He's a success story because he failed and came back in and succeeded. And he's an RN now, full RN, a very good nurse. That doesn't play into it. They don't even know that aspect of him. I happen to know him because I happen to know him for 6 years now. Met him on day one of prereqs. Good kid, and he's a kid. He's 24 years old. He's not even half my age. Okay, I'm 52. He's 40. He's 24. He's younger than half my kids, So he has been passed over, and maybe it's a question of his assertiveness, because when the time came to shine, the day shift charge nurse, let's call him Jay, came up to me and said, "Okay, Ray, looks like you're charged." And I said, "Hell is I'm charged. Fuck you. I don't want to be charged. T can be charged." And he's like, "Oh, okay." And I grabbed and T just walks up and he's like, "Oh, I'm going to be charged." Because my friend Jay is writing it on the board. I said, "Yes." He's like, "Wow, I've never been charged before." Jay turns to look at me like I threw him under the bus. He's like, "Hell's no, Ray. You're charged. The hell with that." So I was like, "No, stop right there." And I say, Jay wants to be. T wants to be charged. And the day charge nurse goes to him, Jay goes to him, "Do you really want to be charged?" Like he's dumbfounded. It's a hapless, it's a thankless job. And T starts wishy-washy, not being assertive, not being whatever. And he's like, well, if you guys really want me to be in charge, I guess I can do it. And And Jay's like, fuck you, Ray. I'm gonna put your name. I was like, no, stop. I had to stop both of them. I said, because I talked to T for months about this. I even mentioned it to Jay a couple times. I was like, you want to be charged? Yes or no? Stop right here. Stop the bullshit. Do you want to be? I had to push him into it. He's a young kid. He doesn't know. He doesn't have life experience yet. And a lot of things. I said, you want it? Yes or no? Here it is. And he's like, and I said to Jay, I said, he wants to be charged. And he even said, do you really want to be charged, T? And T's like, yeah. And Jay's with it enough and, experienced enough that he knows, okay, he does. He just needs that confidence boost. So I had to convince both of them to let T be charged. Sure enough, he was charged for 2 days in a row. All right? And he did a great job. Yes, there was shit hitting the fan left and right. But like I said to him at the end of the 2 days, I said, T, that would have happened whether you were charged or not. Okay? The RT, the whatever, the assault, all that stuff, right? Correct? Yes or no? I mean, it wasn't like your fault or it's because of you being charged. If I was charged or whoever was charged, that would have still, the events would have occurred, right? Unfolded exactly like they would have. Pretty much, right? He's like, yeah. You've learned a lot, right? He's like, yeah. You got to boost his confidence. You have to have some assertiveness. That's something you guys, whether you have it or not, maybe you do. If you have too much of it, tone it back. And that's the subtlety that I'm getting at with the video, is that you can easily go to the dark side and be an asshole. Believe me, I know a lot of nurses, especially females, that are the typical bitch. That you think of stereotype, the mean battle axe nurse, because they think they have to be mean to be assertive. I could use a couple of analogies that aren't probably PG. You can be dominant without being mean. Dominance doesn't mean you're mean. It just means you're assertive. You take charge. It's commanding soldiers or whoever or your crew doesn't mean you have to be mean to them. That doesn't mean you're in charge. It just means you're an asshole. Authority comes from respect and applying it when you should and earning that respect. Okay? So that's something that a lot of people mistake nursing world. That there is a need for assertiveness, but it doesn't have to be assholeness. Okay? And, my friend T knows it. My friend Jay doesn't give a shit. And he's a great charge. And he's one of our top nurses. But, and he is that way. It's just, people misread him. I say, no, he's not an asshole. He just don't give a F. And he's going to tell it like it is. He's made our assistant director cry, because he called them out on something that he was right. Everybody else would have been bullied out. But he said, no, this is not right. So he asserted himself. He's a very take charge guy, whereas T still needs to learn that, you need to advocate for your patients, and that's a mark of a good nurse. Advocate. You got to be a good advocate, okay? So that's my tip. I'm sorry it's so long. I didn't mean to make this a long video, but I had to get everything out. All right? Good luck.